I am Dr. Joy Varghese, Senior Consultant Neurosurgeon and Neurointerventional Surgeon, Apollo Hospitals, Chennai. I am here today to talk about arterious venous fistula embolization, a procedure which is done to treat diseases affecting brain and blood vessels supplying the brain. When we talk about arteriovenous fistula, we have to understand that it is a disease affecting blood vessels supplying brain. There is an abnormal connection between artery and vein inside the brain. Artery has got a very high pressure, and when a connection happens between artery and vein cannot tolerate that much pressure, and so there is a high chance for the vein to give way and produce hemorrhage inside the brain. When it happens so, patient will have very high, severe headache. Sometimes they may lose consciousness, sometimes they may present with fits or seizure. And we treat the seizure, then we investigate with CT scan or MRI, then we understand that such a disease is existing, and then we have to treat it by a treatment modality called embolization. Embolization is a procedure which is done to block this abnormal connection between artery and vein so that the bleeding doesn't happen again. Here I would like to introduce Mr. Mohammad Kutubuddin, who came to me with such a problem. He is hailing from Bangladesh, and he had a problem. He was repeatedly getting seizures for the last 6 years. Suddenly, 1 month back, he had an acute severe headache for which he was evaluated radiologically through using CT scan and MRI, and the doctors there found that there is an abnormal bunch of vessels, blood vessels, inside the brain, and the patient was referred here for further treatment. Understand that these treatment modalities like pinhole neurosurgery or neurointervention need to be done in cath lab. People may be aware about cath lab because that is a place where the angiograms are done. The heart angiograms are commonly done. So likewise, the brain angiogram is done first, and then understand where exactly the fistula's connection is. Go there with small catheters or micro catheters and micro wires, which are very small, can be taken there through the groin, the blood vessels which are supplying the leg, take it through all the way to the brain, and then reach there and put chemicals there to block those abnormal connections. So this is the treatment modality which we call pinhole neurosurgery, and a part of it is AVM embolization or embolization methods. So here I would like to introduce Mohammad Kutubuddin, who has undergone such a treatment modality. Now I would like to ask Kutubuddin that what happened to him so that he can narrate his story. Kutubuddin, आपको क्या तकलीफ हुआ था? आप बंगला में बोल सकते हैं और क्या ट्रीटमेंट किया?
5 বছর আগে আমার ফার্স্ট এই প্রবলেমটা দেখা দেয়, যেটাতে দিয়ে আমি হঠাৎ করে বেহোশ হই। বেহোশ হওয়ার পর প্রচণ্ড ধরনের খিঁচুনি আসে। খিঁচুনি থেকে আমাকে ছিড়ান এবং আমাদের রাজধানী রেফার করে, সেখানে আমাকে কিছু ওষুধ দেয়। ওষুধগুলি খেয়ে আমি দীর্ঘদিন ভালো ছিলাম। এবারে 5-6 বছর পরে আবার হঠাৎ করে এই প্রবলেমটা দেখা দেয়। 2 মাস আগে একবার দেখা দেয়, আবার 1 মাস আগে একবার দেখা দেয়। 1 মাস আগে যখন আমি ডাক্তারের কাছে যাই, তিনি আমাকে MRI করে বলেন আমাকে উন্নত চিকিৎসার জন্য ফুল হাসপাতাল চেন্নাইতে যেতে হবে। তো আমি আপনার কাছে আসি। আসার পর এই ট্রিটমেন্টটা নিলাম। নেওয়ার পর মোটামুটি নিজেকে সুস্থ বোধ করতে। This is my opinion.
Yes, correct. So usually when we do an open neurosurgery, when we open the brain and treat this sort of problems, the patient need to stay in the hospital for a longer time, and it takes more complication chances there. Considering all this, pinhole neurosurgery carries very less complications. At the same time, the patient need to stay only few days inside the hospital. In his case as well, Mr. Kutubuddin's case as well, the patient stayed only for 2 days. The third day, the patient was ready for discharge. and understand this abnormal connection was situated in his speech area. So whenever he used to get fits, he used to lose the speech for some time because the abnormality was in the speech area. So such high profile areas or very important areas in the brain will get affected. We have to be extremely cautious while doing it. Every artery and every vein which is connected to this abnormal connection should be examined in detail, studied in detail before we execute the procedure. Fortunately, in Apollo hospitals we have a biplane machine which allow us to see the brain in two different angles at a given period of time, so that the information which we can gather through those machines is very good, very elaborate, so that execution of such embolization procedures is much safer and very, very specific, so that we can save his speech while doing the procedure. When we do such sophisticated procedures in like smaller machines, there is a possibility that we may miss some of the details of these malformations and there can be complications. So biplanar machine help us as well in this sophisticated treatment of more complex diseases like what Mr. Kutubuddin had. Thank you very much.